just to tell you something that I've learned just in the past week. In my work, I have been talking to people in the insurance and risk management industry, and quite interesting. I was listening in on a private equity call, and the subject of insurance came up because this has been disastrous for private sector insurance. I was directed to somebody at Marsh and McLennan, and they did work back over the last 15 years on trying to build an insurance product for pandemic prevention. And obviously, there were a number of discussions about business interruption insurance and, you know, property and casualty. The problem that they had trying to sell insurance products and price them, well, there were two problems. One is it was a high impact and at that time believed to be a low frequency event. You can't sell insurance very effectively for a 100-year event. Secondly, the cost of insuring it was astronomical because they were only looking at the cost of paying against damages. When I spoke with the gentleman from Marsh and McLennan, he said there's currently the beginnings of a dialogue between the private and public sector, not just about risk management, but risk reduction. And that's a very welcome sign. And that gets to prevention. And one of the things I didn't mention earlier was that what was where the light bulb went on for me back in 1990 was a book about the quality movement, because before 1990, the belief was you either have quality or you have low cost. And there was a book called Quality is Free. And very recently, and as recently as this afternoon, I talked with a veterinary pathologist who's been in the field for several decades and a woman who is a leader of the One Health Commission. The cost of going upstream and having a pandemic surveillance system and acting proactively is an infinitesimal fraction of the cost of paying out insurance claims. And I don't think the government and other people that looked at Bob's map absorbed that particular point. There was the woman who isolated the West Nile virus in the Bronx Zoo discovered that there were jurisdictional and regulatory gaps where there's a lot of attention paid to human health and there's some attention paid to regulating livestock. But in terms of biosurveillance of wild animals and the 185 million companion dogs and cats we have in this country, we have no surveillance system whatsoever. But the cost of building a surveillance system is in the well below 100 million.